Red alert! This is one of those segments that we talked about.
Yeah, it's gonna be a little rough, especially around neck. So just make sure if you're wearing a tight shirt, now it's time to loosen it up a little bit.
This one's called Growing Pains. We're on segment 1. So when we first take a look at this, Doc, it just looks like a cute puppy.
Maybe a little skin rash, kind of fluffy, so you don't really know, right?
I could tell by the background, this looks like it was your emergency room.
It was, and it was an emergency. Came in not knowing what's going on with the neck. Owner really did think the dog got bit or just had a little infection down there. After a closer look, yeah. What do you think happened?
I'm a really smart, intelligent individual, so I'm going to say that it probably had a collar on or some kind of a rope.
Bingo.
Right.
So here's the thing, right? Like people, pets grow. They do. And they go very rapidly within that first 0 to 6 months. So if you have a collar around that neck, I mean, I get the hair. It's one of those fluffy frou-frou pets, but you got to pay attention and adjust accordingly. If not, it just gets tighter and tighter and tighter and tighter. And the dog is going to fight through it, and it's going to dig into that neck, move around, and it's going to just rub and cut and dig until you see this right here.
Wow. So you're saying that like this came into the emergency room probably late one night.
Yeah.
And they just suddenly saw some blood. I mean, that doesn't seem like something that would happen like instantaneous. It seems like it would happen over time.
They didn't see it. They smelt it because it smelled that infected. So it gets to a certain point. We start normalizing, right? You pet him. How do you pet this little guy? He's probably like 15 pounds, like this, right? On the ground. So I'm never going to say, oh, come on up now like a German Shepherd. And they're like, let me pet your chin. So this situation, you're going to smell it and say something don't smell right. Then you start to investigate. But again, to your point, I agree. It didn't happen yesterday. That's been going on for quite some time. Someone finally got hip to it.
This is probably a simple thing, but I'll ask anyway.
Come on.
How do you avoid this type of situation?
Make the proper adjustments to the club whistle. You got to. They grow, right? And then honestly, when you get those normal routine vet visits, the veterinarian will assist you into helping you with the not so obvious conversations, like, placement of materials around the neck.
I'm also going to question when they ever clean this dog because, again, it didn't happen overnight. And at some point in time, they would have taken the collar off and they should have seen.
You would think
something
that.
would-
I mean, priorities.
Okay.
All about priorities.
Such a kind man. I'm gonna leave my opinion to me right now.
He can't talk. She can't talk. It don't matter. So out of sight, out of mind. It's not your pain. It's theirs. And the puppy gonna be a puppy. Yeah. Unfortunately, that puppy's wagging that tail, coming in the hospital. Like, hey, don't worry about my almost lacerated neck. I'm fine. It's just gonna cut off.
Man, that's pretty bad.
It's pretty deep, right? So that did require just some wound treatment, clip and clean, medical treatment. It wasn't too deep where it got into the trachea or esophagus, but it was given that. It had some systemic antibiotics, obviously some pain management, and some strong education for all people in the household because it's a family affair. Somebody should have caught that.
Somebody should have. You made it through our red alert. And we're going to go on to segment 2 coming up.